Hey everyone, it's Lisa Majeski here, the president of Gold Star Medical Business Services. I'm so pleased to be here with you again as we continue our learning about durable medical equipment, how to bill and get paid for it. Now, for those of you who have been listening in on the webinars that I've done previously, we've done a few webinars already on DME and bracing, about the benefits of it and some of the really extraordinary opportunities providers of physical medicine practices have to be able to deliver DME and bracing during this COVID-19 crisis. And so now that we have a number of doctors who have listened to the webinars that I've done and who have, really explored the whole issue of DME and bracing, now that you are enrolled in Medicare as a DME supplier, and many of you have successfully done that, now we have the next step. It's like, okay, now I'm enrolled, so what do I do? And that means that we have to know how to bill for it correctly and how to document medical necessity so that when you do bill for these DME supplies and the braces, that later on down the road, the money doesn't get taken back because you haven't documented your, your medical necessity for these braces. So it's super, super important that now that you're enrolled to be a DME supplier, that you know how to properly bill for them. And so that's what we're going to talk about today. And the first thing I want to say is that, again, this webinar that we're doing contains information and regulations that are a result of the COVID-19 public health care emergency. And while Gold Star Medical and myself do everything we can to verify the accuracy and relevancy of the data due to the fluid situation with the COVID public health care emergency, we can't guarantee that this data will be accurate or relevant at the time that you're viewing this webinar, because obviously this webinar is going to be recorded, and you may be viewing this, several months down the road, and some of the data that's in here may no longer apply. And of course, if you ever have a question about that, we'll be giving you our contact information so you can call us and find out for sure whether the data is relevant or not. And so again, please be aware of that some of the data that's in here applies directly to this time that we're in, which is the COVID-19 public health care emergency. So now that you're enrolled as a DME supplier, what now? We've got it now. We've got the ability to prescribe DME for our Medicare patients and for our commercial patients, and we're enrolled as a DME supplier. And what do we do now? So the first thing I want to make sure that you understand is that you may feel, in a way, a little bit lost as we're talking. I'm going to try to fill in as much as I possibly can from prior webinars, but obviously I can't go through the prior webinars that I've taught in the same amount of detail as in this webinar. So I'm going to be pulling some data from prior webinars, but if you really want to know, maybe you're listening to this and you're not enrolled as a DME supplier yet, but you want to find out how to do that, then please make sure you go to either my website or the website of Advanced Medical Integration, who's so graciously hosting me to provide this information for you. The websites are on your screen. You can go to daily.amidoctors.com/replays to listen to these webinars on the AMI website, or you can go to the Gold Star Medical website. And basically, if you go to my website, at the top of the page, there is a button that says webinars, then a drop down that says webinar archive. Click on the webinar archive and you'll see all of the webinars that we've done dealing with DME, provider enrollment, telemedicine. There are a number of webinars that we've done in the past month or so that pertain to providing healthcare services during this public healthcare emergency due to the COVID-19 crisis. So let's make sure that you know where those webinars are, so that if you do feel like, oh, okay, I need to know more information about this before I take this any further, that you'll be able to go and watch these webinars. And again, if you ever have any questions, you can certainly contact me directly, and I'll have my my contact information displayed here in just a few minutes. So let's just talk about DME in general. DME, first of all, has to be ordered. So in order for you to build, you can't just put a HCPCS code for DME on a claim form and bill it out and expect that DME to get paid. It has to have a provider's order. Now, a chiropractor, because we are doing this webinar to clinics in which that may be owned by chiropractors in whole or in part, or physical medicine clinics that deal with physical therapists, nurse practitioners, MDs. We may have a number of different healthcare providers that are listening to this webinar. So if you're a chiropractor, many commercial payers, personal injury carriers, and work comp carriers will accept a doctor of chiropractic's orders for DME. In other words, who writes the prescription for the DME. In many cases, the DME would have to be prescribed or ordered by either an MD or a DO, a nurse practitioner or a PA, or sometimes a PT. And those would be in cases of commercial payers, personal injury, work comp, Medicare, and Medicaid. Now, a chiropractor cannot order a brace or a DME supply to Medicare. Now, they can own a DME supply company. They can bill for the DME, but it still has to be ordered by a medical doctor or a DO or nurse practitioner, so on and so forth. So the bottom line with who writes the orders for the DME is really very payer specific. So I always recommend that you check your payer rules and guidelines on who can write the order for the DME, who can prescribe it, because that prescribing physician or that prescribing chiropractor's NPI will have to be on the claim form in order for that DME supply to be paid. DME can be billed, bracing can be billed to commercial payers, to Medicare. It does require that you enroll as a DME supplier if you want to bill DME or braces to Medicare, Medicaid, personal injury, and work comp. So all of these different entities could pay for DME supplies under the right conditions. Now, how do you order those braces and supplies? And this is a little bit of review from some prior webinars, but I think it's important to kind of put everything together here. So how you order the braces and supplies is, number one, use a reputable company. Don't just order from an overseas wholesaler because you can get it cheaper. A reputable company is going to help you establish letters of medical necessity. They're going to provide you with training on how to deliver that DME or that brace to the patient, and you're going to want that kind of support. And so make sure the supplier gives you all the support you need to successfully deliver, fit, and get paid for that bracing. They need to help you with the necessary documentation. They need to give you guidance on what conditions that brace might be indicated for, and provide you with the training you need to properly fit the brace to that patient. So super important that you hook up with a good supplier. Now, I have done a little bit of research on this, and I highly recommend this supplier. Obviously, there are a lot of them out there, but I have done quite a bit of vetting on Azon Medical. And for physical medicine practices, multi-specialty practices, medically integrated practices, this is a wonderful organization to work with. They really, really are thorough in providing you with the necessary training and support you need to be able to effectively bill for these DME and these supplies. So Azon Medical is a wonderful organization. Their contact information is here on the screen. I would highly recommend that you write that down and you contact Azon and get more information about the DME supplies themselves in general and how they can support you in successful billing and management of those DME patients. Now, these are some commonly prescribed supplies for physical medicine and chiropractic patients. These are very commonly prescribed in medically integrated practices. And of course, there are a lot of DME supplies, everything from wheelchairs to hospital beds, but we're going to really hone in on the physical medicine practices and what you could deliver safely and successfully to patients, especially during this COVID healthcare crisis, that you could deliver and be able to offer via telemedicine or some type of a remote way to get that DME or supply to the patient. So, so these are some the HCPCS codes that you would bill, the billable codes for a TENS unit, for example, E0730, the HCPCS code for a lumbar sacral orthosis, prefab off the shelf L0650, and then the knee orthosis, single upright thigh and calf with adjustable flexion and extension joint, L1851. Now the prices that you see here are Medicare allowables as of January 2020. Now some states may reimburse more, some states may reimburse less, commercial payers may have higher reimbursements, and as you'll see in some later screens, they may even have lower reimbursements than Medicare. So Medicare typically pays very, very well for DME. And so what you're going to need to do is to know how much your Medicare payer covers for DME. We'll show you how to do that here in just a minute. But these are some common modifiers. So, you know, I just showed you the common CPT or HCPCS codes for the DME supplies that you might be billing for. And of course, if you have a question about the specific HCPCS code, your supplier, like Azon Medical, can give you the correct code to use based on the supply that you're purchasing. And so, but some other common modifiers that you will be used in DME billing that you might not necessarily see on other claims are the ones that are shown here on your screen. So the KX modifier, some payers require that you use that modifier on the HCPCS code, and basically that says that you have met the specified requirements in the medical policy. And very specifically, some of the requirements that are needed to successfully bill DME would be establishing medical necessity, having a letter of medical necessity or a standard written order, SWO, in the patient's file. And if you've done that, then you're letting the insurance company know that you have that documentation available on request if the payer wants it. Another one that is similar is the CG modifier, which is the policy criteria have been applied, meaning that you have fulfilled all the criteria of the Medicare LCD for that particular DME supply. And we'll talk about Medicare LCDs here in just a little while. Then you have the NU modifier, which means that the DME is purchased new. That's new durable medical equipment purchase. And then you have the RR, which is a rental. Now, sometimes DME can be rented, like as in the case of hospital beds or you know, certain other supplies. And the payer will let you know whether the rental option is available. And if that's the case and you do decide to rent that to a patient, then you would use the RR, and you could basically bill that out once a month as a monthly rental to the patient for a certain period of time. And again, you'd have to know what the payer guidelines are for that supply and for that rental. For example, how many months could you rent it for before the patient either has to purchase it or you have to turn it back in? And so those are some very specific requirements that you have to meet. Then you have the RT modifier and the LT modifier. And of course, this is super important if you're prescribing knee braces to the patients. or elbow braces, anything where you have a right side and a left side. And you would want to make sure that you have the RT modifier. And if I gave you the wrong side, I'm going to apologize because I teach yoga. And so I'm always saying that the right is the left and the left is the right because I'm facing my students. So please, if I seem a little dyslexic about that, I apologize in advance. But you know, you have the right side and the left side. So you're going to have to be very specific, like if you're selling a knee brace or prescribing a knee brace, as to whether it's going to be on the right knee or the left knee. And remember, if you do that, then the corresponding diagnosis code has to match up to that. So if you're prescribing a knee brace for right knee pain or right knee instability, then you have to make sure that the diagnosis code indicates that diagnosis is for the right knee as well. GA is another common one that is used. This lets the Medicare or even a commercial payer know that a waiver of liability is on file. And I do recommend that when you are selling DME to a patient or prescribing DME for a patient, that you notify them in advance that if the payer considers it to be not medically necessary, that the patient would be responsible for the cost of that supply. You have to pay up front for these supplies, and it could be several $100s per brace. And if for some reason the insurance company does not cover it, whether you don't meet the medical necessity criteria or the documentation requirements, or whether unbeknownst to you, the patient recently purchased a DME supply, the same exact supply from another provider, and the insurance company will only pay for it once every so many years. You may not know that, so you're going to want to get a waiver of liability for that supply so that if for any reason it is denied, then it can be not denied to patient responsibility, and you're not required to write that off and then eat the cost of that supply. So at the very least, you want the patient to be able to meet your costs for that supply so you don't lose money on that claim. And then RA is a replacement of a DME item due to loss, irreparable damage, or when the item has been stolen. And so and we'll talk about here the replacement of a DME brace. And this is really important when you are doing an interview with a patient or you're doing a consultation with a patient on DME. One of the questions you need to ask is if they have ever been prescribed that DME before. And if they have, especially if they're a Medicare patient, Medicare is going to have that on record. And basically Medicare's rule is that it will only replace it if the patient has had the item in their possession for its whole lifetime, meaning the DME supply's lifetime, not the patient's lifetime, but the lifetime of the supply. And an item's lifetime depends on the type of equipment, but in the context of getting a replacement, and this comes directly from Mediquit Care, I'm quoting them, it is never less than 5 years from the date that they began using that equipment. So if the patient had a brace prescribed 2 years ago, a knee brace, but that knee brace is now worn out and they need a new one, or maybe it was stolen, or maybe it was damaged, you can apply for a new brace, but you're going to have to show Medicare just cause as to why that brace needs to be replaced. So really be aware of that. Now, under the COVID-19 waiver, the Secretary of the Department of Health and Human Services authorized waivers and modifications under Section 1135. And basically, providers can apply the condition code, meaning a modifier CR, which is catastrophic disaster-related modifier for Part B billing. So if the patient needs a new brace, you can use the modifier RA with a CR and get that brace replaced. And so this is a good opportunity for patients, Medicare patients, to get a new brace that has maybe really been worn out and, and just does not function well anymore. But it is less than that 5-year time period. So be aware of that. Now, your commercial payers are going to have different guidelines for DME replacement, and it's going to be very important if you're interviewing or consulting with a patient who has had that DME purchased prior to within that 5-year time frame or within the guideline of the commercial payer. You've got to make sure that you're justifying the need for that replacement. The other thing that you're going to want to do is you're going to want to look up your fee schedules for the DME so that you will know, number one, how much, when you're charged so much by the wholesaler or by the supplier of that DME product, and then you bill it out, how much are you going to get reimbursed and what kind of a profit margin are you going to make? And so to get your DME fee schedule from Medicare, you go to cms.gov and then click on the Medicare tab, which is the one on the far left, the yellow tab on the far left, and then follow the links for the DME POS fee schedule. And you'll find that there's a whole bunch of choices, but look for the one that says DME POS fee schedule. And then you can download, there's a download, which is a zip file of all of the DME supplies that Medicare covers and what the fee schedules are. Now, one thing you'll notice is that I'm showing you a snapshot of this. It's a huge Excel file that you'll get. And what you'll have to do is you will have to look at the supply itself. So this one is, I'm showing you the snapshot of the fee schedule for Florida for the lumbar sacral orthosis. And so, and it will also let you know if this supply can be rented or if the supply can be purchased. And so if you're required, if a modifier is required, it will, in the modifier column, it will say RR for rental and NU for purchase. Now there is no modifier indicator, so this particular supply cannot be rented, which means that you don't need the NU modifier. The only time you need the NU modifier, which is a new equipment, is if there is an option for a rental or a new purchase. If there is no option, then there's no modifier needed. Medicare will assume that it's new. And so Medicare will give you a ceiling and a floor, a minimum and maximum to bill, and then your actual fee schedule. So you'll notice that under Florida, you'll see a column that says NR and then Florida R. NR stands for non-rural and R stands for rural. And so if there is a difference in the fee schedule between a non-rural community and a rural community, you will see that next to that supply code. Now, you can see in this particular supply, the L0650, that there is no difference. So it doesn't matter if you bill it in a rural community setting or a non-rural community setting, it's going to be the same reimbursement. Now, I'm going to show you the TENS units, though, do have a differentiation between non-rural and rural payment. And so that's something that you would need to be aware of. So this one, for example, is the is the knee brace, the ceiling and the floor. This one particular is Tennessee. So the Tennessee reimbursement for the knee brace per knee, $903.76. And Texas, you can see, is $903.68. So really, you're going to see anywhere from a, several dollar to, it could be a several $100 differential depending on the state and even the locality. So for example, the Los Angeles area is going to have its own locality. And if you're selling that brace and you're in the Los Angeles County, you're probably going to see a reimbursement closer to $1,100 because of the cost of living differential. or if you're in Alaska, for example, or Hawaii, where the cost of living is significantly higher, you may see a higher reimbursement for those durable medical equipment supplies. Now, here's the differential on the TENS units. You'll notice, and I just did, this was the national rates for the TENS unit under the purchase. The billed fee is around $405. The non-rural allowance is $72.11. Now, your cost to purchase a TENS unit is probably about $25, okay? You can bill Medicare up to $405. The non-rural allowance, $72. So it's still, you're gonna make about $50 on that TENS purchase. But if you're in a rural area, it's significantly higher. You'll notice that the allowance in a rural area is $238.69. Now, Medicare defines a rural area as a geographic area represented by a postal zip code if at least 50% of the total geographic area included in the zip code is estimated to be outside any metropolitan area. Additionally, the 50-50 blended rate would apply to what has been defined as a DME POS program as a non-contiguous area, such as Alaska, Hawaii, and US territories. So if you're listening to this and you're billing out of Alaska, Hawaii, or any of the US territories, you would get paid based on the rural allowance, which is significantly higher. So there are a lot of providers out there who are rendering services in rural communities, and if you're at least 50 miles outside of a metro area, or your zip code is at least 50 miles outside of a metro area, then you you would basically find that you're going to get the rural reimbursement. Now, I also went out and I started looking around and pulled some supply fee schedules from some commercial payers. So, for example, a lot of the AMI clients come out of Florida. I went to Florida Blue just to see if there was a DME fee schedule, and lo and behold, I found one. And I went to some of the other Blue Cross payers, and they have a fee schedule for their DME, and so you can see that the DME for the lumbar sacral orthosis is $1,250.73. That's what you could expect to be reimbursed when you bill that out to Florida Blue. If you cannot find a fee schedule you go to your commercial payer site and you try to look up a fee schedule but can't find one, you can request one. And I say that, and you need to remember that typically only in-network providers can request fee schedules. If you are an out-of-network provider, you may not be able to request a fee schedule. And so if in that case, you're just going to have to bill it and see what the allowable is. And remember, as an out-of-network provider, you're not required to write off the difference between the allowable and what is billed. That amount becomes patient responsibility. So that's kind of the big difference between in-network and out-of-network. So sometimes you're going to have to request the fee schedule. I went on to Aetna to look up the fee schedule for a client for DME supply and couldn't find one, but I did find an email that we could either call the provider service center for help with up to 10 CPT codes for the fee schedules. And this is not just DME, this is any CPT code. I could get up to 10 in one call, or if I wanted 11 or more codes, the fee schedule for Aetna as an in-network provider, I could enter those codes on an Excel spreadsheet, include the tax ID of my provider, the contact telephone number, the CPT codes, and the modifier, and email them to feeschedule@aetna.com, and they would send back a fee schedule. So many times you can go online, you can get copies of your fee schedules for your DME supplies and other CPT codes as well. So I always have these questions, how do I find out if a brace or supply that I'm ordering needs to be pre-certified or pre-authorized? What are the documentation requirements? What is the criteria for medical necessity to be able to prescribe this to a patient? If the payer is going to cover it, even if, is it even covered under the patient's plan? And can it be ordered by a DC or doctor of chiropractic, or does it have to be ordered or prescribed by an MD or a DO or a nurse practitioner or PA or some other equivalent provider? So how do you find out? I wish I could give you an easy answer, but what I'm going to have to tell you is that you've got to do your homework. So what I would do is go to your payer sites, commercial, if you're billing out to a commercial payer, pull all the guidelines and policies you can find, start creating a database, whether you do this on a spreadsheet or you make paper copies of all of the guidelines and put them in a nice little binder for your providers to have handy, and again, some providers are more tech savvy than other providers, some billers are more tech savvy than others. The bottom line is do what is going to be most comfortable for you. You may be able to pull these guidelines and keep them on PDF documents on your computer in a shared file system. That's what we do at our company. So when we get guidelines, all of our billers are instructed to go to our corporate folder and put those guidelines in there so other billers can access those guidelines as necessary. And then also verify benefits on a patient-by-patient basis. Look, folks, these supplies, the DME that you're billing out for, it's not like billing out just a $100 office visit or a $70 spinal manipulation. You're billing out thousands of dollars, and you want to make sure you can get paid. And you're spending money on these DME supplies, and you sure don't want to get those denials on those supplies, and you've just put out a whole lot of money to purchase those braces or those supplies, and now you can't get paid for it. So do your homework. Don't just slap CPT codes on a claim form and send them out and hope that you're going to get paid. There is a lot more to that when it comes to correct DME billing. So do your homework. Go to your payer site, pull your guidelines, and verify benefits on a patient-by-patient basis. So what questions should you ask when verifying DME benefits? And this was on a previous webinar, but I thought it would be worth repeating. So don't just, if you're verifying benefits, don't just ask if the DME is covered. Give the customer service rep the actual HCPCS code, i.e. TENS unit or lumbar sacral orthosis. Ask if there is a different deductible or coinsurance for DME than for other medical services. And in some cases, an insurance company is going to have a completely separate DME deductible. So you have to know that. Does the supply require pre-auth? And if so, how do I submit for that pre-auth? Where do I send that request? If the practice is not medically integrated and you are 100% DC owned practice and you don't have a medical provider who is ordering that DME supply, you'll have to ask, is the supply covered when ordered by a doctor of chiropractic? And are there diagnosis limitations? I always recommend that if you're really going to get into DME billing, that you have a separate verification form for DME. I know that Azon Medical has a wonderful DME verification form that they can supply you with. We also have some verification templates that include DME on the verification form. So my contact information is at the bottom of your screen here. Please feel free to call or email me and ask me for a copy of that template. I'd be more than happy to provide that for you. And I will also give you the contact information for Azon Medical a little bit later on in the presentation as well. So either one, either myself or Azon Medical, you can contact us and get the supporting documentation that you need in order to verify benefits correctly. Now the following slides and screenshots are examples of how to pull a medical policy or a guideline, and each payer site is going to be slightly different. So this one was for Aetna, And so let me go back to this first slide. So where I went is I just did a Google search. I typed in Aetna Healthcare Professionals, Aetna Provider website. And from there, it took me here. And so I clicked on the provider section, and then I go to resources. So if I click on the resources, this is going to give me a quick links. And if you look down here at the bottom of your screen, there's quick links to credentialing, pre-certification, Medicare information, and medical policy. So you can click on this medical policy, and then from there, you could do a CPT code search. So you could type in your HCPCS code or the code for your supply, and that would help you understand if you have any pre-cert requirements. And so that's going to be very important. Do I need to pre-certify these codes? And so if you type in that code and they say that there's no pre-cert requirements, that's great. If not, you might need to do more investigation into how to do the pre-cert. And also it gives us clinical policy bulletins, and this will help guide you to the correct data on establishing medical necessity and what your documentation needs to be for these Aetna DME claims. And remember, the Aetna DME medical policies are going to be different than Blue Cross of Florida or Blue Cross of Indiana or Humana or United Healthcare. You've got to go to each payer to get these policies gathered up so that you have an understanding of what the medical necessity criteria is. Now, I will say that, you know, a lot of them are going to be similar. There's going to be a lot of similarities. Some are going to be exactly the same as Medicare's requirements. Some are going to be slightly different. But the bottom line is you do not want to be chasing after this DME money if you don't have to. If you know what the requirements are up front and you can bill it according to those requirements, you're going to be much further ahead of the game. I'm a big proponent, for those of you who know me and for those of you who've worked with me, I'm a big proponent of doing your homework and getting it right the first time. Because even though it takes a little bit more time to do that, it takes a lot less time than chasing after the money on the back end. Always. It always takes less time, and there's always less risk of loss if you get it right at the beginning. So I'm a big stickler about that. That's as I'm training my billers, you know, who work with some of you as clients, you know, I drive that into them to make sure that they're doing their homework up front and making sure that they know these medical necessity guidelines. So I just did I wanted to see if the lumbar sacral orthosis needed pre-cert under Aetna. And so I went ahead, if you see at the bottom left-hand corner of your screen, I typed in the HCPCS code for that lumbar sacral orthosis, and here's what it told me. It said, if I am a participating provider, no pre-cert is required when this service is performed as an outpatient procedure for a medical or surgical diagnosis. Very good. If it might require pre-cert for behavioral health, I'm wondering why a lumbar sacral orthosis would be needed for behavioral health, but okay. But it also tells me something important. So you have to make sure you're understanding what it's saying. It's telling me that if you're a participating provider, no pre-cert is necessary. But what if you're non-par? And of course, you know, a lot of the folks that are listening to this may be AMI clients who are out of network with a lot of the commercial payers or all the commercial payers. So you're going to have different guidelines that you're going to have to make sure you understand. So and what Aetna says is if you're a non-participating provider, hospital, or other healthcare professional, the member's plan may require pre-cert, which means now you're going to have to go and call Aetna for that particular patient's plan to see if you're going to need to pre-cert as an out-of-network provider. So be aware of that. There are going to be differences between billing DME out-of-network and billing DME in-network. So the next question that I get a lot is, how do I document that medical necessity for the DME or the supply? So for Medicare, what you're going to do is pull something called the Local Coverage Determination and Local Coverage Articles, also known as LCD and LCA. So the LCD for DME comes from the DMERC, and DMERC stands for DME Regional Contractor that you're billing out to, or from the National Supplier Clearinghouse, which is Palmetto GBA. This is an example of Noridian Medicare. So if you are in an area in which you're billing out to Noridian Medicare, and actually prior webinars discuss this in a lot more detail as to which of the suppliers do I need to bill out to. If you have to bill out to Noridian Medicare, you would go on, this is a screenshot of the homepage for Noridian Medicare, and I would look for the correct jurisdiction, which you can see at the bottom of your screen is durable medical equipment, prosthetic, orthotics, and supplies. And then I'm going to click on the link that says active LCDs. And when I click on that link, I will then do a search by HCPCS code or by keyword spinal orthoses or lumbar sacral orthoses, and it will take me to the correct LCD. And then what I would do is I would click on that link, L33790, and notice that, interestingly enough, that this is, when I clicked on this link, it gave me the fact that this LCD is not only applicable to Noridian, but CGS administrators. So if you're billing out to CGS administrators as your DME regional contractor, then this LCD would apply to you as well. So here's what the general documentation says. I'm just showing you a few screenshots, but again, it's going to be really important for you to pull the entire LCD and read through the whole thing so that you have a clear understanding of how to establish and document medical necessity. Okay, it gives you general documentation requirements. It's basically saying that in order to justify payment for DME POS items, suppliers must meet the following requirements: SWO, standard written orders; medical record information including continued need and use, correct coding, and proof of delivery. So those 4 bullet points have to be met for all DME supplies for your documentation requirements. Now, then you refer to the LCD, standard documentation requirement article, located at the bottom of this policy, and then any related documents for additional information regarding these requirements. So in other words, there's going to be a document about standard written orders. What does a standard written order need to contain? How does it need to be conveyed to Medicare, either by submitting it or on your claim form with the correct modifier, okay? And so you will have to make sure that you understand very clearly what those documentation requirements are. This is just an example of a little bit further down the LCD, and if you'll notice, I found that this does apply to the L0650, and it says that a spinal orthosis is covered when it is ordered for one of the following indications. So these 4 bullet points, number 1, 2, 3, 4, tell you what kind of diagnosis codes Medicare would be looking for to reduce pain. So if the patient has low back pain, the diagnosis code M54.5. And these are just examples. I'm not saying that this is the diagnosis code you use, because again, it's based on the individual patient and based on the medical necessity criteria that you're establishing for that patient. You cannot apply a one-size-fits-all rule for DME billing. It has to be based on what the patient is presenting with, what kind of condition you're prescribing that DME for. Are you prescribing that DME to facilitate healing following an injury to the spine? In that case, you might want to use an S code, which is out of Chapter 19 of the ICD-10 code book, which relates to conditions as a result of an injury or accident. And that would be a lumbar strain. S39.012A for active treatment, D for subsequent treatment. And again, it's going to depend on what part of the treatment plan the patient is in as to when you're going to submit for that. So if you're going to, for example, prescribe that LSO at the beginning of care to help facilitate healing, then you're going to use the A code. But if it's afterwards and now you're in the recovery stage and you're doing this later on in the treatment plan, you might want to use the D as the 7th character extension instead of the A. Maybe you're prescribing this following a post-surgical procedure like a post-laminectomy syndrome, and you're giving the patient an LSO to help stabilize the spine or to otherwise support weak spinal muscles and or deformed spine. And so there's a diagnosis code M53.2X6, which is spinal instabilities in the lumbar area. So these would be relevant and valid diagnosis codes as long as in your narrative you are looking at that history as why you are prescribing this to the patient. It says if a spinal orthosis is provided and the coverage criteria are not met, the item will be denied as not medically necessary, okay? And so some of these, you really, really need to read through these different bullet points to make sure that you are prescribing and ordering and documenting the need for this DME supply correctly. It will also provide you with some coding information. So there's some modifiers that they provide you in the LCD itself. And so interestingly enough, the modifier that they provide you for the policy criteria applied is CG instead of KX. So if you get a denial for an incorrect or missing modifier, always check your payer guidelines for the correct information on how to file for that DME using the appropriate modifier. Commercial payers will also have clinical policy bulletins as well. So coming back to Aetna, and the reason why I use Aetna as my example is because Aetna is national. Blue Cross, you're going to have to go to each one of your individual state payers. So some of you fall under Anthem Blue Cross. Some of you are Horizon Blue Cross, CareSource. These are all Blue Cross or Blue Cross subsidiaries. You've got to go to these very specific payer for those guidelines for your particular state. So obviously in this webinar, we're dealing with attendees from all over the United States and the contiguous US states and territories. So I found a policy that is fairly national and fairly universal. So you go to Aetna, again, providers, healthcare professionals, and you click on the link that says medical clinical policy bulletins. You can type in your keyword and then it gives you the results of that, okay? And the one that I found that most directly related to the L0650 was orthopedic casts, braces, and splints, medical clinical policy bulletin for Aetna. And if you open that up, it's very, very specific as to what those policies are. It says that most Aetna traditional plans cover DME as a standard benefit. That's good to know. Aetna HMO plans, however, do not cover DME without a policy rider. So that's important to know, because if you're dealing with an Aetna HMO plan, you're going to have to check for details on that. And so if you look at the lumbar braces, it tells you, again, it gives you the same 4 bullet points that the Medicare LCD in different orders, but pretty much the same bullet points that the Medicare LCD gave us. And it also states that following a strain, sprain, supportive lumbar orthosis, are used to render support to an injured site of the back. The main effect is to support the injured muscle and reduce discomfort. So again, when you're looking at these guidelines, these are clues as to what you need to have in your narrative to establish medical necessity in your documentation, okay? If you're using those kinds of words in your narrative, then you're going to be much more likely to have that claim upheld on any kind of an audit, or if you have to appeal a denial, then your documentation is going to support it based on the medical necessity criteria of the payer. So enough said about medical necessity. You really, like I said, it's just going to be extremely important to document medical necessity for these DME supplies. Now, a couple of other things you need to know for those of you who are going to actually be doing the billing out of the DME. You know, I was really talking a lot to the providers, but now I'm going to be talking to those of you who are actually billing out the DME. Number one, remember that DME is usually billed out under place of service code 12, which is home, and not 11, because that is where the brace or device is being used. So make sure you set up your fee schedule correctly. Most software programs default to 11, which is office, all right? And so you're gonna have to look at your fee schedule, make sure you change that from place of service code 11 to place of service code 12. Make sure you're applying the correct modifiers per the payer guidelines or the Medicare LCD. So maybe you need a KX modifier for a knee brace, RT, LT, and so on. Make sure that the ordering provider's name and NPI number is in box 17 and 17B of the CMS 1500 claim form. Remember also that the DME and supply that you're billing for is going to have a specific criteria for medical necessity. You're going to hear this a lot when you verify benefits and you ask the customer service rep at the insurance company, is this covered? And what is this covered for? They're going to say based on medical necessity, or they're going to say it's diagnosis driven. So that means that they're going to be looking for a specific diagnosis code to be attached to that supply to establish medical necessity and payment for that DME supply. Your documentation has to clearly support the need for the brace or device. Make sure you have a letter of medical necessity, or SWO, standard written order, in the patient file. You don't have to submit that with the claim unless the brace or device requires pre-cert or the payer requests it. And be prepared, because a payer might hold or pen that claim and ask for notes. So don't ignore those requests. If you get a request for notes on anything, whether it's a medical procedure or DME supply, go ahead and send those notes in, but make sure your notes clearly establish medical necessity for that supply. And remember also that you cannot bill for that supply until the patient has taken delivery, which means you have a bit of a risk. You're going to have to purchase that supply ahead of time. That's money out of your pocket. And then you're going to have to wait until the patient has received that supply and it's in good working order in order for you to bill that out. Okay, if you need more information on this, again, my contact information is at the bottom of the screen. Feel free to contact me, and I'll be more than happy to consult with you about this. I went ahead and just to give you a visual of what it should look, what a DME bill should look like on a claim form. This is what you're seeing now. Some of you may never have seen a paper claim form, and because a lot of us bill 100% of our claims electronically. However, if we're still billing out on a paper claim, and even if you're billing out on an electronic claim, these elements have to be present. Under the electronic claim, it's going to be called a loop or a segment. Under the paper claim, it's going to be called a box. And on paper claim forms, we have 33 boxes and sub boxes therein. So if you look at box 24, for example, of the claim, you have box 24A through J. All right, all of this is box 24, but there are sub boxes within that box 24 area. And you'll notice that A represents dates of service, B represents place of service. Remember how I said you have to have the place of service code is 12. Your procedure code, L0650, your modifier, if applicable. the diagnosis pointer. So the diagnosis pointer that you're seeing here, A and B, relates to box 21. So box 21 is where you place your diagnosis codes. This one is for low back pain and lumbar spinal instabilities. And so this particular claim, both of these conditions were applicable, so we pointed A and B to this lumbar sacral orthosis. You'll notice that some of these are in black and some of these are in purple. The purple ones are payer specific. So what you're seeing in black, the name of the referring provider and the NPI is required on all DME claims. A diagnosis code is required for all DME claims, and so on and so forth. But the ones that are purple are payer specific. Okay. Now for Medicare, you'll notice under the service or facility location, this only needs to be populated if the services were furnished in a hospital, clinic, laboratory, or any facility other than the patient's home or physician office. Enter the name, address, and zip code of the facility along with the NPI number. And then the organization that is providing the supply, your tax ID is in box 25, and the address, the name and the address and phone number of that accompanying or that's corresponding organization from box 25. Your information is in box 33, along with your type 2 NPI number. Okay, so this is in a nutshell what a typical DME claim is going to look like when you're billing it out. Okay, so just to give you a little bit of a visual of how that might look different from other medical claims that you're billing out. I know one thing that's different is the charge. Okay, and you'll notice I put this charge was $1,800, which is this was billed out to a commercial payer, billed out $1,800. The reimbursement was probably about $1,200. So there's, as if I'm in network, there's going to be a write-off when that claim gets paid. But you would put your billed charge in there, whether you accept assignment or not. One of the nice things about your Medicare claims, just for you to be aware of this, is if you are a non-par provider with Medicare, you can accept assignment on DME claims if you have a DMERC or a DME PTAN. And you can be a non-participating provider under DME, but still accept assignment. And in many cases, non-participating providers for Medicare will want to accept assignment for DME because of the cost of the DME. It'd be very expensive to bill that, to make the patient pay upfront for that DME supply and then have the patient reimbursed by Medicare. Most patients aren't going to be able to afford that or not going to want to pay for that, not when they can get the supply with very little out-of-pocket costs on their end if they go to another medical supply store. So just be aware of that. You can, even as an out-of-network provider, accept assignment for DME without incurring any major penalties. If you accept assignment, you're going to have to take assignment and you're going to have to take the allowed rate. So be aware of that. Now, another thing that you need to know about when you're billing DME is that you don't bill DME to Medicare. As I said, the Medicare provider that you're using to bill out your medical services, whether it's Noridian or Novitas or Palmetto, Wisconsin Physician Services, etc., is not the same supplier for DME. You're going to bill the DME to the Medicare DMERC, DME regional contractor, in which the patient has permanent residence. This is kind of crazy. So for those of you in Florida, if you have a patient who has temporary residence in Florida during the winter, but has permanent residence per their Medicare enrollment and per their driver's license in New York, you're going to be billing it to the New York DMERC, even though you're a provider in Florida, okay? And to do that, you're going to have to apply for EDI enrollment for those DMERCs. And this is for this is very specific to Medicare. So be sure before you start filing any claims out, you know, if you, some of you may have just recently gotten your DME P10 and you're all excited and you're like, I'm ready to bill and I've got my ducks in a row. Those claims will go nowhere until you fill out and apply for the EDI enrollment. You do this through your clearinghouse. So if you're using TriZetto, you go into the STEM and you apply through STEM to the EDI enrollment for that DMERC that you're billing out to. The DMERC will not accept claims submitted through your clearinghouse without an approved EDI enrollment. So be aware of that, and that usually takes, you know, a few days to a few weeks to get that enrollment. So time is of the essence. You want to get that EDI enrollment done as soon as possible. A few final things before we finish up here, you know, kind of some reminders. Be sure to always have a letter of medical necessity or standard written orders on file in the patient's chart if in case the insurance company requests it. Be sure to have written confirmation of delivery before billing out the claim for that DME or brace. Okay, remember, you can't cut corners. You've got to wait until the patient receives the supply before you can submit the claim. Now, there are some revisions or changes to billing DME during the COVID-19 national public health care emergency. And so we're going to talk about that as we finish up. And again, remember, if you're listening to this and we're past that public health care emergency, some of the billing discussion we've had is going to still be relevant and some of it is not. So one of the big revisions is the revision on DME delivery signature waivers. CMS is waiving signature and proof of delivery requirements for Part B drugs and DME when a signature cannot be obtained because of the inability to collect signatures. Suppliers, meaning you as the supplier, should document in the medical record the appropriate date of delivery and that a signature was not able to be obtained because of COVID-19. I would still recommend that you have tracking on that DME supply and that you get that tracking number and the proof of delivery through the tracking, like UPS will give you tracking confirmation of delivery, and to make sure you put that in the patient's chart. Some wording that you might use in your documentation was LSO was delivered to patient's home via UPS. Date of delivery was April 20th at 5:30. Carrier confirmation, you can put the confirmation number. Unable to obtain signature due to risk of exposure of COVID. And that's all you have to do. So make sure you, and you can check with the commercial payers. They have also kind of jumped on this bandwagon and have waived DME signature waivers. So the patient doesn't have to physically sign for that DME. But do check with commercial payers as to whether they are honoring this COVID-19 waiver. Also, there is the flexibility for replacements. This is a good opportunity for you to be able to get DME replacements for some of your patients that have old LSOs or old knee braces that you know, have damage to them or aren't working anymore, or they've lost. They have the flexibility now to waive those replacement requirements, and such that the face-to-face requirement, a new physician order, and new medical necessity documentation are not required. Supplier still has to include a narrative description on the claim explaining why the equipment must be replaced, and are reminded to maintain documentation indicating that the DME supply was lost, destroyed, or irreparably damaged, or otherwise rendered unusable or unavailable as a result of the emergency. Okay. Also, a big one, prior authorization. CMS is pausing the National Medicare Prior Authorization Program for certain DME POS items. And so you may not have to get prior auth where for a certain supply where prior auth might otherwise be necessary. Another one that is important, especially for us right now, as we are all kind of struggling a little bit or challenged with cash flow crunch. You may be thinking, gosh, you know, if I can't bill this DME until the patient has taken delivery, I don't know if I can even afford to buy the supply in order to have it delivered to the patient. So what am I going to do? And Medicare has, for Medicare, they have offered advance or accelerated payments. They are authorized to provide accelerated or advanced payments during the period of the public health emergency to any Medicare provider who submits a request to the appropriate contractor, which should be your DMERC, and meets the required qualifications. Each MAC will work to review requests and issue payments within 7 calendar days of receiving the request. So if you are really cash poor and you can't afford these supplies, then go to this link, www.cms.gov/files/document/accelerated and advanced payments fact sheet for more information on how to get an accelerated payment or an advance on your DME payment so that you can afford to purchase that supply. So where are we going to get the help that you need? I know we went through a lot of information in this past hour, so I don't even know how long I've been going, but you know, we've gone quite a while, and you need extra help. And so if you need extra help with the supplies themselves, here is the information for Azon Medical, which is my recommended supplier. Information about us. We can help you with things like verification of benefits, pre-auths. We can help you file your claims correctly. We can help you with denial management of your DME claims or other medical claims. We can train your office on how to do these steps. We can either do the billing for you, or we can train your office on how to do them. So if you would like to have a complimentary consultation with me on how to get started with all of this, or you're just like overwhelmed with all of the information that was provided today, give me a call and I'll be happy to set up a time to chat with you and discuss your needs with you on an individual basis. And again, you know, I thank you again for your attendance. Thank you again, Advanced Medical Integration, AMI, for being such a gracious host of this wonderful program that you're doing for your clients and opening it up for the medical and chiropractic profession in general. If you want more information on how to medically integrate your practice, give them a shout. If you're listening to this and you're not medically integrated but may be interested in it, give them a call. For billing or credentialing help or virtual training for your staff, give us a call. And for questions on DME and supplies, give Azon Medical a call. So this concludes our talk today. I hope you enjoyed it. I hope you got a lot out of it. And we'll see you again next time, and we'll try to provide you with more relevant and informative and helpful content to help you through this COVID-19 national healthcare crisis, and to help you grow your practices both during this crisis and after. Thank you so much, and God bless.